Good morning, and thank you for joining us for the webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on April 30th, 2021, and is scheduled to run from 10 to 11 a.m.
Wonderful. Thank you, Barbara. So thank you everyone for taking some time out of your morning to join us for this webinar. My name is Stephen Profiter. I'm the Director of the Early Learning and Care Division at the California Department of Education. Today's webinar is full of new and valuable information as we look forward to providing you each every other week with the most up-to-date information as possible. A quick note that in a couple of weeks, we're anticipating the release of the governor's May revise, scheduled to be around, it's due each year May 15th, but May 15th is a Saturday, so we're anticipating May 14th. So with that in mind, we may need to reschedule the Friday webinars in 2 weeks, but once we have a new date and time determined, we'll make sure to send out a notice to subscribers to our distribution, our email distribution list. So there are lots of exciting things happening in addition to May revise in a couple of weeks. Earlier this week, President Biden announced details of the American Families Plan, which included proposals for universal pre-K for 3- and 4-year-old children, and many important investments in childcare to support families, and of course, absolutely addressing the workforce, which is crucial for our field. In addition, I hope you were able to attend the first webinar in the series, Creating Brave Spaces in Early Childhood, this past Monday, so earlier this week on April 26th. The next webinar in this series will be held on May 10th from 6 to 8. The first webinar looked at the impacts of bias, racism, and hate on young children, their families, and on early childhood education. The webinar on May 10th will dig into exclusion, suspension, and expulsion in early childhood education, and how children of color are disproportionately affected, and how we can recognize, talk about, and create change in dispositions, behaviors, and systems to meet the needs of all young children. I hope you'll join us for the next webinar. We just got the registration link for it. There will be an email going out later to share more details, and I'll ask Brittany if she could drop the link into the chat. But of course, this link will also come out in an email later to subscribers of the ELCD distribution list. Before I hand off to Erica, I want to again thank you all for everything you're doing every day for your children and families. I also want to thank those of you that are impacted by the transition of programs from the CDE to CDSS. Even without a pandemic, this transition would be a difficult transition. We feel it at our level, but we know that you have a lot of questions. You're absolutely feeling it as well. And some questions remain unresolved, but please know that we are working on these answers and looking at how to triage other issues until we have permanent solutions. And with that, I'm going to hand off to Erica.
Eric, you are.
Yeah, I am muted. I need to unmute myself. Technology. Thank you so much, Steve. Erica Otiona again. As you know, just a quick reminder, the PQI office, the Program Quality Implementation Office, the folks that are responsible for monitoring, training, and technical assistance. For today, 3 presenters from the office will provide information to you. Lisa Velarde, administrator, will introduce Joycelyn Ward Richardson, who's a consultant and PQI's training lead. She will provide updates for our upcoming exciting farewell activities. I can't wait. The activities are specifically designed to show our appreciation to contractors for working closely together with ELCD and also our Program Quality Implementation Office, as some of us transition to CDE, to continue the work of ensuring that every family receives the support and guidance that will enable their children to get the necessary foundation for good beginning, for long life learning. Roseanne Pitt will also provide you with information on all other PQI activities specific to monitoring and transition. I will not be here for the closing of this webinar because I have another call. Please continue to reach out to us as needed. We are still very strongly committed, as usual, to working with you. Stay safe, get vaccinated if you want to, and continue to follow other guidance from CDC and your local public health department. Enjoy this session, and remember that we appreciate you and all that you do for children and families in your communities. Over to you, Ms. Virginia.
Thanks, Erica. So good morning, everyone. I just want to echo everything that Steve and Erica said about thanking all of you. For those of you who don't know me, my office is lead and working with the legislature and the governor through the policy development process, and then working on implementing that through guidance. And so there'll be more on that through this webinar. I will now turn it over to Alana from the policy office, who will be our moderator today.
Good morning, everyone. My name is Alana Andrade, and I'm a child development consultant in the policy office here at ELCD. I'll be moderating your webinar today, and we have, as usual, a wonderful team answering questions and making this presentation run smoothly for you. Also from the policy office, we have Danielle Davies, Eric Dunk, and Barbara Lindsay. From the Program Quality Implementation Office, we have Roseanne Pitts, Crystal Devlin, Lisa Velarde, Jocelyn Ward-Richardson, Mignon Pollard, Deborah Rawson, Lupe Lopez, Cassandra Lewis, Brittany Sheffield, Dear Zong, Richard Miller, Serene Yee, and Christina Boulay. From the Child Development, Nutrition, and Fiscal Services, we have Andrea Johnson, Corey Kahn, and Alan Lynch. From the Child Development Management Information System, we have Carly Nodahara and Robert Halm. And to answer any questions regarding nutrition or the food programs, we have Cynthia Loreto and Shakshi Sharma. As usual, our team is committed to being as responsive as possible. Just to reiterate, our team will not be able to answer every question. We also really appreciate being able to engage with you via our Q&A feature. The chat is turned off, although you will see Brittany sending off links within the chat, but you cannot chat us. Please utilize the Q&A feature for the rest of the webinar. Back over to you, Stephen, to review the agenda.
Wonderful. Thank you, Alana. So as you can see from the agenda and from what you've heard already, we have many things to cover. We'll go over some pieces related to some June 30th or post June 30th guidance, I should say. We have some guidance related to the recent Management Bulletin 2108 that was released yesterday. Also excited to share the Nutrition Services Division has joined us for this webinar. We'll be presenting information on some USDA guidance that was recently released regarding food programs. PQI team will update us on 12-month eligibility and monitoring. Our fiscal team will be discussing the annual contract rollover process as well as stipends. After, we're going to cover questions you have, and we'll get to as many as we can, either live or through the Q&A function. So please use that tool to submit your questions, as Alana mentioned. Of course, for any questions we don't get to, we will take those back to address as FAQs on our website. And before I hand off to Virginia, I'd like to reflect just a moment on the team that puts these webinars together. It's so wonderful. You heard all the names. It's a big team, but you know, we're all here for one thing, and that's to make sure that you all are supported. You've got the information you need, and as timely a fashion as possible. I mean, all the way around with this team, it's a labor of love, and I appreciate this team so much. So thank you. Thank you, team. And without further ado, I'm going to ask Virginia to rejoin for our next topic.
Thanks, Steve. So this is an area that we know many of you are eager to learn all about in terms of our post-June 30th guidance. So we wanted to give you an update. This is a very hot topic for us as well, as we're getting closer to June 30th and thinking through guidance. So there are a couple areas where we're hearing about this from the field, just to recap. The first one is post-June 30th COVID-19 guidance. Which of the current COVID-19 flexibilities will be extended? For example, every webinar we get a question about whether the hold harmless provisions for direct contract programs will be extended. The second area that this is coming up from you all is guidance related to the transition. For example, you want to know which rules apply to CFPP after the transition. And second, the last one is really around guidance for the transition related to any statutory changes that are made to implement the transition. So just to go through these quickly with you all to let you know where we are, as we like to be fully transparent with all of you. For the COVID-19 post-June 30th guidance, this is mostly an area where we're waiting for the legislature to take action. So we can't tell you yet, for example, whether the direct contract hold harmless will be extended, because in order to make that happen, the legislature will need to amend Education Code Section 8208. And that's just one of the many examples. So there are some areas where legislative action won't be required, and we're starting by sitting down as a team to look at those and flagging which areas do depend on legislative action. So we have a cross-division team that's hard at work on this piece, and we'll be including DSS in those conversations as well, since we know that, after June 30th, really CDE will be giving guidance on CSPP, since CSPP is remaining at CDE after the transition, but the other, many of the other programs will be transitioning to DSS. In terms of transition guidance, this is an area where we'll be developing FAQs to your commonly asked questions. For example, a common question we get is, will CSPP still have the same licensing requirements after the transition? And by the way, the answer to that one is yes. So that's a bit of a preview of one of those FAQs. We know that another area that a lot of folks have questions about is whether families that have one child in CSPP and other children in CCTR, for example, or another subsidized program, will be able to go through a streamlined intake process, similar to what currently happens, and have the same families file. So we'll be sure to cover the answer to those questions and others like it in our guidance. Our cross-division team of staff that are working on this guidance is prioritizing this area first, since there are many aspects that we can get information out to you that don't depend on legislative action. So if there are particular items that you want to elevate to ask us hot questions about, please put those in the Q&A box so that we can capture them for the team. So we won't necessarily have the answer to all of those questions right now or today, but we'll take those back to our team that work on the guidance so that we can make sure that what we are developing addresses your concerns. So on this piece, just want to reiterate, we're closely working here with DSS as well, but also want to flag for you all that CDE is only going to be able to issue guidance for CDE programs, which after the transition will be the state preschool program. So we're committed, and we continue to work very closely with Department of Social Services to share both our expertise and our knowledge with them about the programs that are transferring over. But any guidance about current CDE programs that will be at DSS after the transition will need to come from them. So the last sort of category on this chart here this slide is the transition statutory change guidance. So this is also an area where we're waiting on legislative action. So for example, just to give you a better sense of what this is, there's currently a 575 pages of proposed statutory changes that's on the Department of Finance's website to implement the transition. So if you want a bit of reading, we're going to put the link in the chat. So Brittany, if you could put that in the chat, that would be great. So while Brittany does that, I'll keep going. So this trailer bill will be implementing the transition by moving the statutory authority for programs that are transitioning from Education Code to the Welfare and Institutions Code. So it's a different code of statute. In some cases, this trailer bill, it's called a trailer bill because it sort of trails the Budget Act as sort of a companion to the Budget Act. Where the Budget Act is implementing the transfer of funding, the trailer bill is implementing the statutory changes needed to affect the transition. So in some cases, there are code sections that both state preschool and the programs transitioning will need. So a great example of this is the code section 8263 that has the eligibility requirements for our programs. And in some places, the trailer bill makes changes to current processes to implement the transition. So for example, the childcare pilots will now have to submit information to both CDE and DSS for anything that's CSPP related would need to come to CDE, and anything that's related to programs at DSS would need to go to them. So I do want to note really quick that the trailer bill that Brittany just shared the link to is also still pending legislative action. So what this means is that the legislature is in the process of reviewing it and may have edits. So we don't want to go too far down the guidance road on this one if the language is going to change. And obviously we can't actually give directive until we have something that's signed into law. So we did want to flag this for you as an area where we will be releasing guidance. And similarly to the other categories, we'll be working closely with DSS so that each of our departments is aware of the guidance that the other department is developing. So just a quick last piece on this one, which is that it's the format of our guidance. So we know, for example, that we've tried a couple different methods of issuing our guidance in the last year or so during COVID, and so we want to continue to be thoughtful about what the best format for our guidance is. So we know that many of you have appreciated getting emails, these webinars, our robust FAQs. And so we want to build on that learning and making sure whatever guidance that we develop in these three areas is as accessible to you as possible. Likely for each of these bullets, what we're looking at is an email guidance with follow-up FAQs that will be developed, depending on feedback that we get from you all and the specific details of what happens. We may be looking at management bulletins as well in specific areas. So if you have feedback on what type of communication works best for you, feel free, more than free, to share it in the Q&A box so we can capture that and bring it back to our cross-division guidance team. So that was a lot of upcoming guidance. So now I'm going to turn it over to Crystal, who will go deeper into a piece of guidance we released yesterday. Over to you, Crystal.
Thank you, Virginia, and good morning, everyone. Management Bulletin MB 21-08, guidance regarding the extension of temporary emergency childcare services, enrolling new families in temporary emergency childcare, transition into ongoing childcare services, and assessment of family fees for essential workers and at-risk populations was released yesterday, April 29th, and can be located on the CDE Early Learning and Care Division Management Bulletin webpage. The information in this MB applies only to California Alternative Payment Programs, CAP, and California Migrant Care Alternative Payment Program, CMAP contracts. This management bulletin rescinds and replaces Management Bulletin 20-14, which provided similar information regarding temporary emergency childcare services for essential workers and at-risk populations. So you will recognize some of the information in this management bulletin, such as transitioning families into ongoing childcare services, the assessment of family fees, and reporting requirements. The updated information in Management Bulletin 21-08 is in response to the passage of Assembly Bill AB 82 and AB 86, which provided $76 million for the extension of emergency childcare services for families who are currently enrolled through June 30th, 2022. In order to continue providing emergency childcare services for those families currently enrolled, contractors do not need to collect any new documentation from families, but shall issue either a notice of action or the extension of services letter that is linked to in Management Bulletin 21-08. Additionally, AB 82 and AB 86 provided $80 million for enrolling new families into emergency childcare services through June 30th, 2022. Unlike emergency childcare services that were previously authorized by Senate Bill 820, families who are now enrolling into emergency childcare services are required to meet the eligibility requirements as set forth in the California Education Code, EC, Section 8263, and must either be an essential worker or the child or children must be a member of one of the at-risk populations as included in the management bulletin. AB 86 did allow for COVID or for families to self-certify their eligibility for emergency childcare services, and the COVID-19 self-certification for temporary emergency childcare form that is linked to in MB 21-08 has been updated to reflect the requirements for eligibility. So if you have a saved copy of the form that was linked in Management Bulletin 20-14, I recommend that you delete it and save the revised form to ensure you use the correct version when enrolling new families into emergency childcare services. Also, for two-parent families, each parent is required to complete a separate form. Excuse me. The contractor must also check the family's self-certified income and family size on the form and make sure that the family is income eligible before approving the enrollment of their child or children into emergency childcare. This self-certification form is the only documentation that the contractor can collect from families in order to enroll them in emergency childcare services and must not request any other documentation from families. Again, families who are being newly enrolled in emergency childcare services must meet the eligibility requirements in Ed Code Section 8263. Previously, essential worker families and at-risk populations could be over the income eligibility threshold and still be enrolled in emergency childcare services. That no longer applies. So pay special attention to the section in MB 21-08 regarding enrolling new families into emergency childcare. As always, if you have clarifying questions, you should contact your assigned Early Learning Care Division Program Quality Implementation Office consultant for technical assistance. Now I'll hand it over to Cynthia to go over the new USDA guidance.
All right, thank you, and happy Friday, everyone. The CDE Nutrition Services Division is very excited to announce that the USDA has provided us with timely guidance for the upcoming school year. On Tuesday, April 20th, the USDA announced a series of nationwide waivers, numbers 85 through 96, to support school nutrition and child and adult care food program sponsors for the upcoming year. Many of these waivers are effective July 1st, 2021, and extend through June 30th, 2022, except the following: the meal pattern flexibility number 90, which goes from October 1st, 2021 to June 30th, 2022, and the on-site monitoring waivers number 94 through 96, which goes from August 4th, 2020 to 30 days following the federal declaration of the end of the pandemic. These waivers extend many of the flexibilities that have been available during the pandemic already. The CDE is still working on a process for sponsors to opt in. As soon as we have developed the process, we will be issuing a communication and updating our COVID-19 guidance web pages with that information. Let's take a look at the flexibilities that have been extended for the Child and Adult Care Food Program operators. So the USDA is also extending waivers that provide flexibility in how meal service operations are set up. Program operators, regardless of the program that they are operating, will all be able to offer the non-congregate meal service for Child Nutrition Response Waiver number 87, have flexibility in the times that meals are offered for Child Nutrition Response Waiver number 88, and will continue to be able to allow parents and guardians of children to pick up meals on their behalf for Child Nutrition Response Waiver number 89. This applies to these waivers apply to the National School Lunch Program, School Breakfast Program, Seamless Summer Option, and the Child and Adult Care Food Program, or the CACFP. The USDA Food and Nutrition Service does note, however, that these flexibilities should be implemented only until such time when greater levels of congregation and in-school settings are safe and healthy to pursue. So now let's take a look at the meal pattern flexibilities that are being offered. So the meal pattern waiver has gotten a little bit more specific. Based on Child Nutrition Response Waiver number 91, FNS will only allow the following CACFP meal pattern requirements to be waived. So this includes the whole grain rich requirement, implementation of crediting grains using ounce equivalents by October 1st, 2021, and the low-fat milk must be unflavored. So this applies only to CACFP operators and is approved on a case-by-case basis. Meal pattern waivers will continue to be reviewed by state staff and approved on a case-by-case basis. According to this waiver, local agency requests must be targeted and justified, demonstrate need, include plans to maintain nutritious meals, and assure a search for alternatives has been completed prior to using these flexibilities. So the team is determining now if the current meal pattern process will need to be updated. So more information will be released on that process in the future. So Child Nutrition Response number 93 allows the following sponsors, regardless of their location, to claim snacks or meals at the free rate or Tier 1 reimbursement rate as applicable. So that's CACFP at-risk after-school care centers, daycare homes, Tier 1, daycare homes for the Tier 1 reimbursement. So the waiver is effective July 1st, 2021, and remains in effect until June 30th, 2022. Please note that the USDA has not waived the requirement that at-risk can only be operated during the school year. So, all right. So these two waivers, Child Nutrition Response Waiver number 95 and 96, are considered extensions to waivers previously in place. So as a result, their effective date is actually August 4th, 2020, and they will remain in effect until 30 days after the U.S. Department of Health and Human Services declares the end of the public health emergency. So these waivers suspend the on-site monitoring activities and instead promote continued distant or remote reviews until on-site audit practices can resume safely. Election and approvals under the initial waiver continue. However, CDE must track some elements separately. So the CDE is discussing this and will provide more direction in the coming months for this process. So that's actually all for me. Now over to Roseanne for some PQI updates.
Hello, thank you. I'm Roseanne Pitts, an administrator with PQI Central, and I'm presenting today some updates from our Program Quality Implementation Office. So 12-month eligibility, this is just a reminder that at the time of certification or recertification, families are entitled to not less than 12 months of care. Please remember that their care should continue for a full 12 months unless they request to terminate services. For continuity of care, when families request to transfer from one region or another, or even maybe one part of the city to another, please refer them to another state-funded program to maintain continuity of care within their 12-month eligibility period. Now on to monitoring, training, and technical assistance. As Virginia said, and I think Steve said at the beginning of the call, we're in the process of many conversations to talk about how monitoring, training, and technical assistance will continue at both CDE and CDSS as we move toward the 21-22 fiscal year and what we're calling the transition year. Though we don't have specifics yet, we will share as soon as we can. We do want to mention that we are working very closely between the two departments as we move forward during this transition. Additionally, agencies have been asking about consultant assignments. This also is something that we're working on. In some cases, you may have the same consultant you have now. In many cases, you will not. But please rest assured that you will have a consultant assigned to you from both CDE and CDSS. And these consultants will continue to work with you and your agency through this transition period. Remember, we're all in this together. We're all going to kind of learn together and do this transition together. So we will have people that will help you. We will have people that will be able to answer your questions and be available to you as we move through this process. A very special thank you to all the agencies who have gone through reviews this year when we have used a different method of transferring agency information to CDE. We know at times it has been a challenge from both your side and our side. We thank you for your flexibility so that monitoring could continue during this unprecedented time. Again, thank you for all you do for children and families. We greatly appreciate you. And now on to Lisa and Joycelyn for information about our big event.
Thank you, Roseanne. Good morning, everybody, and happy Friday to each of you. We are pleased to announce that the ELCD PQI office will be holding their last webinar Wednesday training series as a year-end celebration with all of our CDE contracting agencies. The celebration is to acknowledge each of our contracting agencies and recognize their dedication over the years, as well as their commitment to providing high-quality early learning and care programs. Joycelyn, let's share a few details about that year-end celebration with the PQI office.
Thank you, Lisa. Good morning, everyone, and happy Friday. We are so excited to hold this special year-end event. It will take place on Wednesday, June 9th from 10 a.m. to 11:30 a.m. No registration is required. The theme for this event is called You Are Our Heroes. As Lisa stated, we would like to honor our ELC contracting agency heroes. If you are interested in participating, please submit a photograph of the heroes of your program. An announcement will be sent through our listserv to all the PQI contracting agency, executive directors, and program directors, inviting you and your staff to join in this celebration with us. So please look out for this email coming out very soon. We have special instructions in the announcement for you to submit a photo from your agency that meet the theme, You Are Heroes. Please see the announcement for more details, or you can contact Roxanne Fiddler at rfidler@cde.ca.gov for photo submissions or for any questions you may have. Again, we are really excited to celebrate with you, so please hold the date of June 9th, 2021. And again, thank you, and we will see you soon. Now over to Alan for the fiscal updates.
Good morning, everyone. My name is Alan Lynch, and I am a manager in the Child Development and Nutrition Fiscal Services, or CDNFS unit. We have just a couple of fiscal updates today. For our first update, I want to address a concern that has been heard from the field related to child development contracts in the upcoming fiscal year. The concern that has been expressed was that contract maximum reimbursable amounts, or MRAs, were being reduced as part of the transfer of child development programs to the Department of Social Services. I want to assure you that no contract is being reduced because of the transfer to DSS. I do want to quickly review the normal process that occurs every year when CDNFS prepares contracts for the new fiscal year, a process we commonly refer to as rollover. CDNFS will be following normal rollover procedures as we prepare the 21-22 contracts. During the annual rollover process, we remove funding that was not intended to be a permanent increase to the contract. Conversely, we increase contracts that had a temporary decrease to the contract MRA in 2021. The most common changes that are reverted during this process are the removal of one-time funding and the returning of funds that were transferred via an interagency or interagency transfer. For example, in fiscal year 2021, one-time funding was provided for a variety of purposes, including waiving of family fees, hold harmless or paying at the maximum certificate, and non-operational days. These again were one-time funds provided for pandemic relief in 2021 fiscal year, and these allocations are not part of the base contract MRA. During the annual rollover process, these one-time allocations are removed from the contracts. Similarly, if your agency is participating in an intra-agency transfer between your CFPP and CCTR contracts, or a voluntary temporary transfer between your agency and another contractor, then these changes will also be reverted in order to return the funds back to their original source. Additionally, for CalWORks Stage 2 and Stage 3 contracts, CDNFS has always used April projections in order to determine the starting MRA for the following fiscal year. This standard process will continue to be followed to determine the initial contract in fiscal year 21-22. So CalWORks contracts are proceeding business as usual. These are just a couple of examples, but CDE wanted to make sure that we were clear that contract MRAs are not being reduced as part of the transition of programs to DSS. Any changes that normally occur between fiscal years are continuing as we prepare the 21-22 contracts. The contracts for next year are still on track to be mailed by CDE by June 1st, 2021. So next, I'm going to provide some updates on the Coronavirus Response and Relief Supplemental Appropriations, or CRRSA, Act of 2021 stipend allocations. As you may remember from our previous webinars, Assembly Bill 82 allocated $244 million in CRRSA funds to provide a flat rate stipend amount of $525 per child enrolled in a state subsidized childcare or preschool program. These allocations were based on a number of subsidized children enrolled in November 2020. As a reminder, for CalWORks Stage 2, CalWORks Stage 3, Alternative Payment Program, and Migrant Alternative Payment, the CDE used caseload data submitted via the CalWORks Alternative Payment online reporting system. For General Child Care and Development, Severely Disabled Program, Migrant Child Care and Development Program, California State Preschool Program, and Family Child Care Home Education Networks, the CDE used data reported in the November 2020 Child Development Management Information System, or CDMIS, CDD 801A report. The initial CRRSA stipends were received by contractors in mid-April. A subsequent set of CRRSA stipends is currently being processed at CDE and is anticipated to be mailed to contractors the week of May 17th, 2021. These subsequent stipends include any revisions that were made to the AP CalWORks caseload data and the CDMIS 801A reports for the month of November 2020 as of April 19th, 2021. Additionally, information was collected for alternative payments, Stage 2 and Stage 3 contracts for children who received services from 2 or more providers during November 2020. Payments for these additional providers are also included in this allocation of CRRSA stipends. An additional round of CRRSA stipends is already planned in order to provide stipends to CFPP, CCTR, CFCC, and CMIG contractors who also had children who received services from more than one provider in a family child care home education network setting. This week, fiscal analysts have been reaching out to contractors of these contract types who reported children in family child care home education networks for the month of November 2020. All contractors providing care in a family child care home education network will receive an email by close of business today, Friday, April 30th, 2021. We are asking all contractors who are contacted to provide their responses by Wednesday, May 12th, 2021. Note that if you hold a CSCP, CCTR, or CMIG contract and you did not provide care through a family child care home education network in November 2020, you will not be contacted, as it only relates to CSCP, CCTR, and CMIG programs who provided care through a family child care home education network. And now back to Alana for the Q&A portion of our webinar.
Excellent. Thank you all so much. There has been a lot of great questions and hopefully some excellent answers back to you all. So we'll have a few that we are popping in. So Alan, I would like you to stay on for a minute. There was a question regarding repeating the information on reverting. I think when they're talking about the reverting of funds.
Yeah, so this is part of the rollover process. And the reverting of funds just refers to the process where we remove any one-time funding that was provided to contracts during the current fiscal year that are not part of the base MRA, or the process through which we return funds that were transferred between contracts as part of an intra-agency or interagency transfer. So the reversion in this case simply refers to taking out those funds that are not permanently part of a contract or returning them back to their original source.
Excellent. Thank you, Alan. So earlier in the chat, there was a lot of ask for wanting to submit some photos. And so, especially for the Our Heroes celebration. And so I just wanted to reiterate what the email address is. Brittany already put that in the chat, but I just want to say it out loud as well. So if you would like to submit any photos or questions regarding that year-end event, please contact Roxanne Fidler. That's RFIDLER @cde.ca.gov. Okay, let's see what some other questions that we've had. We have some questions regarding the management bulletin that was just released. So I'm going to ask that Crystal step back up. So one of the questions is asking, will there be additional guidance for CSVP or CCTR and that have not had emergency childcare?
So at this time, the Assembly bill only authorized emergency childcare funding for our CAP and CMAP, and I am not aware of any upcoming legislation regarding emergency childcare for direct service contracts.
Excellent, thank you. Okay.
Can I just add one piece onto that? So sure. I think just to clarify that 2014, some folks may be sort of comparing 2014 and the new management bulletin that was just released and saying, well, there were pieces for emergency childcare in 2014. Why aren't they in 2108? Or folks might be thinking back to the spring of how last year there were allowed to be enrollments in things like CCTR. And so just wanting to reiterate what Crystal said, totally see where you're coming from with those questions, but we're implementing the statute that we were given, and the statute is only appropriating new funds for the contracts that Crystal mentioned.
So Virginia, with that also, or Crystal, there's a question about for the temporary emergency child care funding. So that's new families that include CSPP and CCTR. I see a nod from Virginia.
So
wait, I'm sorry.
No,
I'm not sure
no.
I'm understanding the question. New families is only for the contracts Crystal mentioned, but I'm going to hand it over to you.
Okay.
Yeah, It does not apply for the emergency child care funds do not apply for CSPP or CCTR. Only California Alternative Payment Programs, CAP, or Migrant Alternative Payment Programs, CMAP. And those programs have received allocations to provide those services.
Excellent, thank you. So there have been some questions in here about documentation, especially I think towards recertification. So I might ask either Danielle or PQI admin to speak up with this. So there was a question, I think it was responded to earlier, and the chat is moving quickly and I can't see it, but someone is asking for an elaboration on if we're requiring parents to give updates on financial issues, like such as getting laid off or getting a new job, and to give new information in the contracts. That might have been Deborah. Was that you, Deborah, that was responding to it?
Sorry, I was responding to another question. Can you repeat that?
Sure. I think this was probably a follow-up question. So elaboration on parents giving updates on their financial issues and putting that information into a contract.
Oh, yeah. Yes, it looks like that Richard actually answered her first question, so it was a follow-up.
Okay. I do appreciate how robust these conversations are. It's also a little bit hard to tag in on that. So Trina, if there's something more specific on the elaboration, we can definitely get that response to you. But let's see, we've got a couple of stipend questions. So I'm going to ask Alan to come back while we're waiting. So Alan, can we use the stipend funds to extend a part-day CSPP program? Or can we use the funds to provide programs in July to support preschool students going into TK or K to increase in-person learning?
Can you tell me where that question was so I can actually read it myself? Sorry, there were a couple others I was wanting to refer to.
Oh, sure. Yeah, I'll find all the ones for this was Tiffany's at 1046. But if there are others, I'll start scrolling up. Oh, I see. Did you find it?
Yeah, sorry, give me just a second. So in general, the stipends can be used for any reimbursable costs that your program would normally report as part of your contract. So some of those questions regarding what your stipend can be used for, I think sort of fall into that category. I don't know if Virginia has more to say when it comes to using the stipend to extend services or how that works with the normal program operations.
Thanks, Alan. I think that's a great question, and we may need to take that back and talk about developing an FAQ to address it.
Excellent, thank you. So Alan, there's another stipend question, which is probably what you were trying to address. So some programs are receiving additional stipend. Why are direct services like CSPP and CCTR not getting an additional stipend?
Yeah, so those are the questions I was actually looking at addressing when I came back. I saw a number of questions regarding the statements I made about the Fetchins, the Family Child Care Home Education Networks, both in the AP Stage 2, Stage 3 setting, or contract type, as well as for the CSPP, CCTR, CMIG, and CSCC contract types. I want to just clarify that this is not an additional funding source providing new stipends. This is all part of the initial stipends that already went out to all of the center-based contractors. However, as we released that funding, the initial funding, we realized that some data was not being captured as part of that initial release of funding. So the subsequent stipends and also the additional purchase stipend allocations that I was referring to during the second slide of the fiscal update, these are all part of that same initial CRRSA stipend allocation. We are just sort of cleaning up who should have received stipends, but were not captured in that first allocation. So these are not new stipends. They are stipends going out to people who should have received them in that initial payment that others received in mid-April.
And can you reiterate that that the stipends go to staff? And can you also reiterate about if there's a time frame for spending the stipend? It's probably more about, is there a time frame for contractors to give the stipend? And then therefore, is there another time frame for the stipend to be spent itself?
Yeah, so there are a few different timelines related to the stipends. If you are receiving the stipend and you need to disperse those stipends to individual providers, the initial guidance that went out did say that you had 30 days from the receipt of your stipend allocation to start paying those providers. The timeline for spending the stipends themselves, I believe, was June 30th of 2022, if I'm remembering correctly off the top of my head. I did see a question about whether the stipend needed to go or could go to staff. I think we have released some previous guidance when it comes to using the stipends to give staff hazard pay, for instance. And there are specific rules related to that. So you can definitely reach out to your fiscal analyst and they can provide you with the documentation for that, unless Danielle or someone has it available to link to that information that has been posted on CDE's website. They might be able to provide that in the chat for you as well.
Thank you very much, Alan. So I know we're running lower on time than we would like. There's a few questions that have been asked revolving about forthcoming information and when we would get it. So I would like, if there's a moment, Virginia, for you to speak on, when CDE can actually release guidance, and therefore as quickly as we could get it out to the field.
Yeah, thank you. Thank you so much, Alana, for this. And you were reading my mind, because I was just thinking that we needed to address that live as well. So we definitely see all of your questions. I think as I presented on the slide sort of towards the beginning of this webinar, there are those three categories of guidance that we're looking at. So the post-June 30th COVID-19 guidance, there's the transition guidance that's not really dependent on statute changing, just sort of being told which way to do things. And then there's transition guidance that is dependent on statute changing. And so for items and the COVID guidance really falls into both categories. There are some things that we really can't do anything about until we know if the law is changing. And we'll have more information in 2 weeks when the May revise comes out on May 14th. But even then, the legislature and the governor are not required by the Constitution to pass a budget until June 15th. And so we will do everything that we can to get you guidance as soon as possible, because we know that many of your programs need to be making these decisions now. But we're also in a spot where we can't direct you as our contractors to do something if there's not a law that gives us the authority to do that, because that exposes us to things like lawsuits. And so, I think generally speaking, if something isn't the law yet, we are not legally allowed to tell you it's the law, so do it. So that's kind of where it gets a little tricky on the timing. So knowing that the urgency around this timeline, and you need to know now, we will continue to share information with you as soon as we have it. We're also, as I mentioned, working on pieces that we can share now that don't depend on the statute, both for those COVID-19 guidance items and for any transition items. And so I think that's not something, that's still very much under development. So it's not, I would love to say, we'll be releasing it in the next week or two, but I think it's probably a little further out than that, because there are so many complicated things that need to be teased out, and so forth. So I want to just pause here, because Crystal's my partner on all of this work from our field lens, and just want to invite her if there's anything more you'd like to say, Crystal. Are you trying to get off mute or? Okay. I know some of our team has had some internet challenges, so we can maybe leave it there, and if we come back with something more, we'll, like I said, we want to communicate with you all. Even if we aren't able to say something right away, we want you to know where we're at, because we know it helps you plan in your programs.
Excellent. Okay, the last few questions are still also regarding stipends. I'm going to ask Alan to come back for a moment. If there is someone wants to check in and verify about stipend allocation, who should they reach out to?
I think the first place that contractors should check in with would be their fiscal analyst. So please reach out to your fiscal analyst. They should have the stipend information, and they can also follow up with me directly if there are any pending questions or we need to check on the status of a warrant or something.
I think that's also, yeah, there was a few folks who were asking about getting it verified, and it looks like that's, thank you, Alan, for answering that. Let's see I'm going to let the team continue to answer your questions in the Q&A chat. And while we're doing that, we're going to do everybody's favorite topic, which is me reading off our lovely websites. So for our resources, the ELCD COVID-19 guidance webpage is where you can find webinar slides and the transcripts. We appreciate your patience with us trying to get those up. We do have to make sure that they're 508 compliant. So we do appreciate your thought and your patience with that. You can also find our management bulletins there and our frequently asked questions. That webpage is https://www.cde.ca.gov/sp/re/ELCD COVID-19.asp. You can also submit questions to our ELCD emergency email inbox. That's elcdemergency@cde.ca.gov. To see a list and reach your PQI office regional consultant, please visit https://www.cde.ca.gov/sp/ci/assignments.asp, or by calling 916-322-6233. As usual, our consultants are most easily reached by email. Okay, I would like to invite Stephen back to help close out our webinar for the day.
Thank you, Alana. And I got to say, I think you might have one of the best seats in the house. I love hearing the little ones in your background. such a joyful noise. Again, thank you all for joining us, and on behalf of all of us, thank you for taking time out of your day. An hour is a lot to ask, so we appreciate you prioritizing some time to spend with us this morning, and we hope that what you're coming away with information this morning that's helpful in your work. We hope that you'll join us for our next webinar here in a couple of weeks. Again, date TBD, pending more information on May revise and finding an alternate. And we'll close here just by saying, please take care. Erica mentioned, get a vaccine. They're becoming certainly more available, but be safe, be kind to each other. We can't do any of this without you. We're looking forward to getting back to normal, and we look forward to seeing you at our next webinar, and have a happy rest of your Friday and weekend.